Hey everybody, this is Daniel. Welcome back. Hope you're taking care of yourself in these ridiculous times. Today, I'm talking to you about a subject that I don't want to be talking to you about because I wish it wasn't happening. But unfortunately, here we are because it is happening. Black people are dying at a disproportionately higher rate and getting sick at a disproportionately higher rate from COVID-19 because of systemic racism. Yes, you heard that right. COVID-19 is taking advantage of systemic racism to disproportionately infect and kill black people. And I wish I didn't have to say this. I wish it wasn't real. I'm tired of seeing black people suffer for no other reason than being black. But here we are. So first, let me give you the data and then let's talk about it. The Los Angeles County Health Department reported this week that black residents were dying at twice the rate its white residents were. The same is true of black Alabamans. In Florida, black people account for a higher share of COVID-19 hospitalizations and deaths than their share of the population. So why is this happening? It's happening because they're black. That's why it's happening. It's happening because systemic racism is real. It's happening because systemic racism has been woven into the very institutions of this country. And so in a pandemic, COVID-19 doesn't ignore systemic racism because COVID-19 isn't sentient. But COVID-19 can take advantage of these fault lines that were already here and disproportionately infect and kill black people. Now, this is not just black people, but I want to talk about how it affects black folks because this is not something I think you're hearing very much of in the news. So we could talk about different ways that it affects black people. We could talk about how it works through racist housing policies. We could talk about how it works through racist medical procedures and practices. We could talk about all that because all of that is true. But you need to understand that black people are dying at disproportionately higher rates, and it's because COVID is taking advantage of systemic racism. Let me give you a few examples so you'll see what I mean. If you look at an article that I've included in the description from NPR, they talk about how black people reporting their symptoms to doctors are not taken as seriously as white patients. They also don't get the same access to testing and resources as white neighborhoods and white people. So why don't they get access to those same resources? Because of where they live. I mean, that's just the reality. So you have black people who are living in different places than white people, and that ultimately stems in part because racist white people in the past didn't want to live with black people. And so then you have all these other things that are tied to where you live. And I'm going to include a link to a great Vox article that inspired this video, and they dig into this even more than I'm going to dig into it today. But they talk about how where you live determines economic opportunities, and those economic opportunities have a direct correlation to your health. And so you have black people who already have diseases and maladies, or as you would say, people would say in the medical community, comorbidities that ultimately tie to systemic racism. We live less time than white people. We have less access to health care and healthy food. We have more chronic diseases that all ties to systemic racism. And so we have all that going on, and we can't get access to testing, and doctors aren't taking us seriously. Of course we're dying at a disproportionately higher rate. Now, this is where I can feel the temptation of some people to blame black people for this. Now, they might not know that they're blaming black people, but they might say something like this. Well, Daniel, protests have been going on. Maybe the spike in the disproportionately higher rates stems from black people going to protest. Now, I would respond to that by saying, well, there's no proof that the protests had any measurable effect on the spike with coronavirus that's most likely tied to states reopening too early. In addition, when I looked at protests and all the footage I've seen, protesters were wearing masks and they were doing as much social distancing as possible. I've seen protests that were entirely social distance. Now, I'll tell you who wasn't wearing masks at those events: cops. And I think it's worth it to have a conversation at some point soon about whether cops have been unwittingly spreading coronavirus by not wearing masks and going out to all these different calls all over the city. But I digress. That's a different conversation for a different video. In addition, some people may say, well, Daniel, I've been seeing videos on my feed of black people just getting lit, having a good time, being at parties, not wearing masks, and not social distancing. What do you have to say about that? Well, I would say that those folks are not the people I'm talking about, because obviously those people put themselves in harm's way when it comes to COVID. And since it's so obvious, we shouldn't even need to bring that up. Now, they have probably infected other people who didn't ask to go to the party, but if they did, we know where that came from. I'm talking about the systemic racism that manifests in various policies and behaviors and norms such that black people are disproportionately targeted by COVID. And I think that's worth talking about because it's happening right now. And so I'm just tired. I'm tired of black people suffering for no other reason than being black. I'm tired of people finding a way to blame us for it. I'm tired of people ignoring our suffering. I'm just tired of all of it. Because in the midst of a pandemic where people are losing their homes, they're losing their health care, they're wondering how they're going to feed their kids, they're wondering how they're going to be able to clock in for work, they're wondering how they're going to shelter their families, they're wondering where they're going to live, they're wondering if somebody could get them sick at a moment's notice, they've got to go to work, they're wondering if their jobs are going to get them sick, their jobs might have already gotten them sick, they might be living with the symptoms of COVID-19 for the rest of their lives. They may be asymptomatic and don't even know it. People are walking around with all these concerns every single day. And black people have to take all of that and add to it that COVID-19 may disproportionately kill us for no other reason than the color of our skin. I'm tired. And I just wish that black people wouldn't suffer so much or at all because we're black. And that's what it feels like all the time.